Imagine you, many ropes tied around every limb and part of your body. They're all different colors, sizes, and material. Each one represents a different aspect of you and your identity. Question: how might pulling one sway the others? This brings me to my essential question. What are the factors that influence the timing of diagnosis of ASD between sexes, and how does the timing of diagnosis influence the effects of depression in this demographic?
Hi, I'm Lea Lagayan, and today we're going to look at both the sciences and social sciences of the ASD spectrum, its history in the DSM, and how ASD affects depression, and lastly, how each aspect of identity can change how each problem is addressed. I wanted to choose this topic of the intersections between autism, gender, and depression because I'm very passionate about the research of neurodivergence and mental illness like depression, and how the current DSM doesn't always consider how these may affect one another. My passion for equality in these spaces originally came from working with neurodivergent kids and then progressed into my own personal research. Um, for a long time, I've wanted to bring awareness about this inequality of gender and show a different perspective of what ASD can look like than what is typically represented in the media.
This is my mentor, Twee. She's an educational assistant in the Burnaby School District, and she's an advocate for people with disabilities, especially ones with hidden disabilities like autism and ADHD. We met through work as a volunteer at a kids club, and we often talk about the work that needs to be done to create a better world for neurodivergent people. Her experiences with working with neurodivergent kids in schools and being a mom of a kid with ADHD and autism really make her a perfect candidate for my project because she brings in her real life experiences into these topics and show how these biases truly affect these people's lives. In my meeting with Twee, we discussed a variety of topics that led me into the direction of my research for my project. My first question was for her: what is your experience working with neurodivergent kids, especially ones with autism? She said that she notices that these kids are capable, but in a world that is so against neurodivergence, that we need more patience and support for these kids in school. My second question was: do you notice an imbalance ratio of undiagnosed autistic girls? If so, what are some factors that you think contribute to this ratio? She said there's definitely was a difference in the rates of diagnoses in women, and that she believes that the leading factors of many girls' traits getting missed in their childhood are the societal expectations of girls to be polite, obedient, and conserved. She emphasized that masking was a trait that is more common with girls, so I knew to look into that as a part of my project. My third question was: what are some of the harmful and positive effects of masking? She made it clear that she does not like that people feel as if they need to hide their traits, but she does acknowledge that there are definitely certain situations where it would be necessary to mask somebody's traits. She used examples from her own son in his experience in the school system. She said that masking for him allows him to be less ostracized and be more accepted by his classmates, but it also exhausts him and can lead to dysregulation and burnout. She says that this could intertwine with the rates of depression for autistic individuals. So I started looking into that for my project. And my final question was for her: what is one thing you wish doctors or medical staff understood better about neurodivergent people? And what are some things that they can do to make them feel safe and comfortable in their care? Twee mentioned that she believes in getting a proper diagnosis, but she acknowledges how the medical system does not always consider the whole spectrum of autism spectrum disorder. She wants a world where all disabilities are accounted for, included hidden disabilities like ADHD and autism. She wishes that doctors, especially ones diagnosing these peoples, would account for all these traits. But how does my project connect to my future career? My long-term plan is to complete a 1-year program towards a science degree and then apply to a radiation therapy or MRI technology school. Both of these careers not only require an in-depth knowledge of scientific concepts, but also a profound understanding of patient care, communication, and empathy. This is where my project becomes an asset towards my future goals. By studying the medical history of the DSM, I can understand how our medical biases came to be. By learning how these inequalities and lack of research impacts others and can lead to different treatments and experiences in healthcare, we can work towards stopping these injustices. As someone who hopes to work directly with patients who trust you to be the expert in your field, I want to know that I am helping them without any of these biases affecting my work. In the future, I will need to approach patients with openness, cultural awareness, and empathy. This project will be one of the first steps in that direction. To answer my final question, I need to deconstruct these intersections of gender, depression, and autism, one by one, to see how each one impacts the others. To start us off with how gender impacts the timing of the average ASD diagnosis. In this UCLA article, it states that, quote unquote, recent research showed that nearly 80% of autistic females are undiagnosed at the age of 18. And by this article by Canada.ca, it states that, quote unquote, males were diagnosed approximately 4 times more frequently than females. This divide is also exemplified by this chart displaying the prevalence of ASD among genders in age groups between 1 to 17 years old. As we know, ASD is a genetic disorder that is not exclusive nor biased towards either gender. Therefore, this phenomena of late diagnoses for women is not explained. So why is gender such a big factor in the timing of diagnoses? The number one reason for undiagnosed autistic women being more common is that the autistic traits were not detected in childhood. There are so many ways autistic girls/women can differ from autistic boys and men, whether it's environmental, societal, or biological. The source is sometimes unclear. One thing that is for sure is that autistic children's brains tend to develop differently based on gender. In a Stanford study, they found that the majority of autistic boys have difficulty with their gross motor skills like walking, crawling, jumping, sitting, etc. This can delay their baby milestones, which are usually detected by a doctor and parents immediately. While girls tend to have issues with their fine motor skills, like writing and getting dressed. These skills are usually seen as smaller milestones than gross motor skills and may go undetected, especially because these traits come later in development. Another way that girls often go undiagnosed is because of the societal expectations for girls. Many autistic traits can be mistaken for typical quote-unquote girl activities. These symptoms include stimming. Some known stims for autism have been majorly based on research on boys, which include a lot of noticeable stims like spinning, hand flapping, rocking. And a lot of girls and women tend to stim more subtly, like nail biting, hair twirling, or repeating phrases. This could be because girls are subjugated into masking their symptoms. Smaller stims means that they can regulate themselves without being ostracized by peers or others. This topic of masking is very important to note because masking is one of the biggest reasons for undiagnosed autistic people. Autistic girls and women have a higher chance to mask compared to boys and men. Masking is a term for neurodivergent people hiding their traits. Many autistic people do this by rehearsing conversations, changing their expressions to mask others, learning social rules manually, suppressing stims, and many, many more. Since autistic girls are more susceptible to masking to avoid negative treatment from peers, this causes the symptoms to go undiagnosed for even longer. When diagnosing autism, the DSM-5 is used to check off traits. It is based off previous diagnoses of autism and research of behavior that is associated. These traits include A. Persistent deficits in social communications. B. Restrictive repetitive patterns of behaviors. C. Symptoms must be present in early developmental periods. D. Symptoms cause clinically significant impairments in social, occupational, or other important areas of current functioning. And E. These disturbances are not better explained by intellectual disabilities. These traits don't differ between females and males, but the way that these traits tend to express themselves may show up differently. The research on these symptoms of these traits have mostly been recorded with a bias of autistic white boys. In a research article on the original testing for autism in 1943, Leo Kanner, MD, concluded that the diagnosis of autism was a ratio of 4 boys to 1 girl. This is because when creating tests for autistic traits, they often use traits found in non-masking boys. A lot of research before the modern understanding is based on Hans Asperger's, a physician who defined quote-unquote autistic psychopathy in 1944 and created the diagnosis of Asperger's syndrome. His work was rooted in anti-Semitism, and he only studied males. Much of his work was used to identify traits and symptoms of autism that was used in past DSM. This meant that before the modern DSM in 2013, there has not been much acknowledgement towards the traits in female autism, and now many girls, now women, were missed or left undiagnosed from that era. The diagnosis process for autism is very complex due to the fact that the symptoms of autism share a lot of very similar traits to other diagnoses in the DSM, especially BPD, anxiety disorder, ADHD, and many others that include social withdrawal, mood swings, and intellectual difficulties. Another possibility is that the person has several neurodivergences or mental illnesses along with autism. To summarize, late diagnosed autistic women are more common than men because girls' traits are often missed or masked due to biological differences and social pressures, and later diagnosis is hindered by high costs, bias, limited research on female traits, and continued masking. Why are people with ASD more likely to experience depression, and why does it affect autistic people more harshly? Being neurodivergent, especially being autistic, comes with many struggles, and a higher risk of depression is one of them. Autistic people often suffer in a society that was not built for them, but there are many reasons why someone with ASD is more likely to develop depression. One aspect of this identifiable trait of ASD is the difficulty surrounding social connections, which is caused by many factors. One includes social relationships, which there is a humongous factor in depression. And there's research that shows that people with problematic relationships have a higher chance to develop major depression disorder. This is important to note because many autistic people, especially high masking people, tend to have difficulty retaining friendships with others. This is due to not understanding social cues, monotone or unusual voice, difficulty with eye contact, meltdowns, and unmasking can lead to making friends difficult. Many autistic people don't feel like they belong anywhere, and sharing experiences with others releases endorphins and provides a distraction from bad thoughts. This provides a reason why depression might hit harder for someone who has little or no experience with relationships. Feeling alone is one way people can develop depression and can affect how our brains handle situations. Another reason that depression could be caused is from a reaction to a traumatic experience, which flips a switch in your brain to respond to negative stimuli more harshly. People with autism are more susceptible to traumatic experiences, especially from bullying, social ostracization, and around 55% of autistic adults have reported for sexual violence or physical violence. We haven't researched enough to say it is due to how autistic people process negative stimuli or if traumatic events are just more likely to happen to autistic people, but this could explain why depression is very common between autistic people. Depression is widely associated with suicidal ideation and low self esteem, and one way autism can heighten this symptom is preservative thinking. A trait in ASD is cognitive rigidity, in which can manifest in special interest or hyperfixation, but it can also manifest in repeated thoughts of anxiety or self bad image. This can accumulate towards suicidal ideation and depressive mood, which would explain why autistic people might respond worse to negative stimuli and therefore might be more likely to develop depression. If you are concerned for a neurodivergent loved one, then here are the signs that you can look out for: a change in functioning, a decreased interest in special interest or safe foods, a major decrease or increase in weight, feeling unexplained guilt, a harder time or bigger delay than normal to process information, and lastly, a feeling of emptiness, hopelessness, loneliness, or sadness for over a 2 week period. There's a lot of similarities between autistic burnout and depression symptoms that present similarly on the outside, but the causes are completely different on the inside. When autistic people experience burnout, it is a response to overstimuli and for high masking individuals using too much energy on suppressing autistic traits and having none left over to function. Depression is caused by a variety of reasons like genetics, brain chemistry, social and psychological factors, and these things can start a domino effect that affects the amygdala to start overreacting to negative stimuli and create chemical imbalances. This can physically change parts of the brain, which controls other parts of the body. This is the cause for fatigue and loss of energy and executive dysfunction in depressed people. Autistic burnout and depression may have similar outcomes like not being able to get out of bed or not being able to do their job because of their symptoms. But it's important to understand and acknowledge the differences and so that people can get treated with the right things.
In conclusion, autism, gender, and depression do not live in isolation. They intersect in ways that deeply shape lived experiences, access to health care, and mental health outcomes. Gender plays a critical role in how autism is recognized and diagnosed, with many autistic girls and women being overlooked due to social expectations and masking, and research bias rooted in male centered diagnostic criteria. This delayed or misdiagnosis often means years without appropriate support, forcing many to navigate a world that misunderstands their needs. As a result, many autistic women are at a heightened risk for depression, chronic masking, social exclusion, unmet support needs, and repeated invalidation can lead to burnout, low self esteem, and persistent emotional distress. Without an autism diagnosis, these experiences are often misattributed solely to mood disorders, preventing effective treatment and further reinforcing feelings of isolation, depression in autistic individuals. Is simply not a comorbidity. It's also a response to system neglect and misunderstanding. Understanding how autism presents differently across genders is essential to address mental health disparities. By acknowledging these intersections, expanding research, and challenging diagnostic biases, we can move towards earlier identification, more inclusive care, and improve mental health outcomes for autistic people of all genders. I wanted to start this project because I wanted to explore my interest in the sciences and sociological effects of neurodivergence. But I didn't realize how important it was and how applicable it was to my future career. I learned about my strengths as a researcher and my ability to break down complex scientific ideas into layered meaning. Now I can connect scientific information with real human experiences, but also at the same time, this project showed me areas where I can grow, like strengthening my critical thinking skills and improving how I evaluate sources for credibility and communicating scientific ideas clearly and with empathy. My mentor had a strong influence on how I approached this project. Through sharing her personal experiences in working in the school system and her life at home, she allowed me to think of the bigger picture. She gave me an entry of where to look at for my research by telling me some of the reasons that she believes there's such a difference between the diagnoses between sexes, and some of the biases that her own family faces in their everyday lives. One section that she really influenced my research on was the reasoning that she believes that people are getting misdiagnoses. She mentioned a lot about masking, and then I knew that it would be one of the most critical parts of my own research. She also influenced me personally. She's inspired me through her constant fight for neurodivergent rights and supports, and she and her son makes me want to speak out against ableism that is so normalized in everyday society. This project has shaped how I view my future career as a radiation therapist and the healthcare system as a whole. While accuracy and scientific knowledge are essential in medical imaging and treatment, this research has showed me that empathy, communication, and being aware of biases is just as critical. Understanding how neurodivergent people, especially autistic women, are often misunderstood or overlooked has reinforced the importance of patient centered care. As a future radiation therapist, I'll work with these patients during their most vulnerable times. And this project has taught me that every patient brings varied experiences, identity, and challenges into the treatment room. I now recognize how masking, trauma, and late diagnoses can affect trust in medical systems. Moving forward, I want to create a care environment where people can feel safe, heard, and respected. My last goal is that I want to start unpacking years of misinformation against mentally ill and disabled people and learn through them, not only through my research, but also through my interactions with them. It's made me realize that they're just like any of us. Approximately 1 in 5 Canadians have experienced a mental illness, and 1 out of 31 people have autism. So many people hide these struggles without us knowing every single day, and if I can make a difference by sharing their experiences, I hope I can help others understand and empathize with them. This project has really allowed me to reflect on my own biases of others, not only in the medical field, but also others around me. You cannot tell what other people are going through just by looking at them. Some of them have hidden disabilities, or they've just had the worst day of their lives, or maybe they're even completely fine on the inside. But when we approach treating others with patient respect and empathy and no prejudice, we can create a kinder world. Thank you for watching.